Welcome everyone. Buenos dias, buenos tardes. Will I say good day? Why not? Today we're joining you from the beautiful Andalusian city of Seville, where we have just had the pleasure of completing 5 days of intense health technology assessment, information sharing, discussion and work at HTAI 2024 Seville. I'm Anne Single from the Patient Voice Initiative. I also have another role, which is Vice President of HTAI. I'm the first to come from the patient communities. So Spain has a very active HTA community. So this is not the first time that this meeting has been held in Spain. And actually, it's not surprising that in HTAI's history, we've had 3 presidents from Spain, beginning with Alicia Granados, who's the founding president of this society. We've had Laura Sanpetro Colon, also from Barcelona, and more recently, Iñaki Gutierrez Ibaluza, from the Basque Country. And I apologize for the Spanish speaking. I'm not fast enough and I'm not accurate enough with my pronunciation, but I've improved a little bit. But thank you to everyone in Spain for their patience, helping me with the language. Our host this year was AETSA, that's the Andalusian HTA body, and the theme was a turning point for HTA sustainability, networking, and innovation. So briefly, who is HTAI? HTAI, it's a multi-stakeholder society whose members volunteer across some highly productive policy fora, working groups, and 11 interest groups, including one that you might be familiar with, the Patient and Citizen Involvement in HTA Interest Group, sometimes called PCIG or PSIG. So at HTAI 2024, Seville, we had approximately 1,000 attendees in person and another 150 online. And they came from HTA bodies, government, regulation, technology developers, university and other researchers, and of course, patient communities around the world. Patient communities, including their organizations, have been a big part of the meeting, with approximately 30 patients supported to attend, patients on plenaries, panels, and workshops, and part of that was many patients being co-authors of abstracts. I also saw on social media last night that someone had calculated that there were more than 50 references to patients in the program. Now, I wanted to share with you, just for maximum travel jealousy, perhaps, I wanted to share with you some of just a few happy snaps we've been taking from the last days here. So let me just share that. Oh, I'm starting right at the beginning. We're at the end, so we'll come back. I can go backwards and forwards and make you look at them twice. So you can see there, that's just part of our patient community that was here in Seville with us. Although we had terrific dinners, we were fed well and shown beautiful things. Thank you to everyone who shared photos. People worked hard. This is some of our members here showing you how hard they were working in the beautiful city of Seville, taking part in plenary sessions, taking part in workshops, this fantastic, interesting one with consumer members from Aotearoa, New Zealand, from the Philippines, from Australia, talking about what it is to be a consumer or patient representative on an HTA committee. And now we're back at the beginning where I intended to start, which is the theme of the meeting. So it's been a hectic time. It's been a fascinating time. And we would like to now talk a little bit more to what actually happened during those days. So over this next hour, we're going to talk about what we will take away from coming here. And that's the aim of the session, to share what people have been talking about at this meeting. And I'm really excited to see that we've also got lots of the patients who are taking part here to in Seville, also online. Do feel free, apart from questions, if you're here and have taken part, feel free to share in the chat some of your great experiences and your experiences generally. But to help me do this morning, I have the Patient Voice Initiative Chair, Jessica Bean, with me, and we also have the 3 Patient Voice partners who came to Seville. And so over the next hour, we're going to be talking to them about what they heard and what they will take away. So to begin with, can I just ask each of the panelists to briefly introduce themselves, beginning with Jessica. Jessica Bean.
Just remembering to unmute. Please excuse us. I feel like I'm not sure if I'm more tired this morning after attending here in Spain on Spanish time, or attending last year in Adelaide with a 6-month-old baby. But for those who don't know me, my name's Jessica Bean. I'm chair of Patient Voice Initiative, but I'm also a patient living with cystic fibrosis related diabetes, and looking forward to sharing what has been an incredible experience here in Seville with you this morning.
Oh, thank you, Jessica. Now I notice there's someone sitting beside you. So Chris, can I ask you to introduce yourself?
Hi, everyone. I'm Chris Pearce, and I'm one of the directors of SCN2A Australia, which is a rare epilepsy syndrome, and obviously parent of a child as well. And I work in health research doing consumer engagement.
Thanks, Chris. And Melanie, would you introduce yourself?
Yeah. Good morning, good evening, Ola. My name is Melanie Funk, and I'm the Managing Director of Eczema Support Australia. I'm also very much a student in this area of patient engagement, and really valued this time to learn more and be more connected with the patient involvement in HTA. So I look forward to sharing more about that with you shortly.
Thanks, Melanie. And last but not least, Karen, can you introduce yourself?
Hola, everybody. What an amazing experience this has been. I am chair of Cancer Voices South Australia and deputy chair of Melanoma Patients Australia. This is my other job, my volunteer role, and I first became engaged about 8 years ago when the drug that saved my life on a clinical trial. I looked around and so many people did not have access, and we were able to amend that fairly quickly in the Australian context. But I could see there were people in other countries who also did not have access, and certainly access has been the fairness of the equity of access has been an issue for me for some time. Yeah, I will talk about this a bit further along.
Thanks very much, Karen. And so for those of you just joining, just a reminder, you can pop your questions in the chat. We also have the wonderful Cecily from Patient Voice Initiative there. And so we're going to monitor that chat and pick up any questions as we go. But I'm going to kick off by asking some questions to our panel who are here in Seville. And Jessica, may I begin with you? You were just reflecting actually before we came online about not everyone can be here in person, and about the privilege to be in person and the importance of having online opportunities for interactions for those who can't come to these events. This is the 3rd time I think you've been here in person with us at HTAI annual meeting. To my mind, it's been a huge undertaking for you to come. You make it look effortless, but this year it's involved doing more than 30 hours of traveling to the other side of the world, and you managed to do that with a toddler. Why, for you, was it worth this investment of time and giving your Better Health Days to event.
Yeah, thank you, Anne. And I do absolutely recognize the immense privilege that comes with being able to travel in person, both from an economic point of view, but also from a health point of view. I know that, and even for me, travel is not always accessible to patient communities. And so we have to think about how we're making sure that all of the voices are included in some way, and that can look like many different things. But at this time, I'm very grateful that my health has allowed me to be able to travel to be here in person. And the reason that that's so important to me is because while the conference program is brilliant and the sessions are absolutely fabulous, the thing that I find so much value in conference attendance in person is those conversations between the sessions, the sense checking between colleagues, the anecdotes that other attendees are able to bring to what we've just heard. And it really adds a depth of new understanding and knowledge to what we're taking away from the main sessions at conference. It has been a really fabulous experience, and particularly I think when there's language barriers, some of the voices that it's really interesting to hear from are our patient community from around the world, and I think that that is something that can be more accessible when you are sort of face to face, or sitting down, sharing a meal, and it's a more relaxed style of conversation. So it has been an immense privilege to be here in Spain.
Oh, thanks so much, Jessica. There's some really thoughtful points there, and it's been great. It's been great to travel with you here. Chris and Melanie and Karen, can I start to bring you in now? Obviously, I think it can be exciting to travel to an amazing place like Seville, but can you each tell me a little bit about why you wanted to do this? And I'd also really value hearing anything you're willing to share about the trade-offs, or what it took to get here, get away from home and spend time here. Chris, maybe I can ask you first.
Yeah, thanks, Anne. It's been a really amazing week, and just being able to sort of really immerse ourselves in the conference has been really rewarding. So for me, I've only really come across HTA in the last couple of years, and largely because in our rare disease there have not been treatments, so we haven't had to delve into the process, but I know that there's plenty on the horizon. And having been to Adelaide last year and become involved in the rare disease interest group that's now been running for 12 months, I really saw the value in coming and working with the people that we've been sitting on working groups with online since Adelaide, and really kind of cementing that rare disease working group. And yeah, that I'll delve into that a bit later, but that's really the reason for me. We've got a plethora of therapies in the pipeline, and I am very convinced that we're not ready, and we don't have our ducks in a row. So that's why I'm here. I really want to help the community prepare for what's coming in terms of supporting HTA processes. In terms of what we had to do to get here, I've got a 22-year-old son who has a complex medical condition and significant disabilities, and he needs 24-hour care. So we're running a 24-hour team at home. We've flown people in from Melbourne to look after him. So it's been no mean feat just to get out the door. And then even while we're here, there's constant checking and lots of texts and emails and phone calls just to make sure that is all going smoothly, which amazingly it has. So yeah.
Well, thanks, Chris, for doing that, because it's a few sentences, but it sounds like it's been an enormous effort to get here, and I really appreciate having you here. Melanie, I'd love your thoughts on this topic too.
Yeah. Look, I'm very grateful to be here in person in Seville. I think the last few years I've really been seeking ways to try to build my confidence and involvement in this HTA process through doing courses and conferences. And last year's opportunity to attend the HTAI in Adelaide was amazing. And it did provide me with that more understanding and networks. And what I found was the attendees were also caring and inclusive, and I really wanted to continue that journey with the HTAI community. The trade-off has been having to rely on others back home to carry some of the weight with my family commitments and work commitments, especially when there's been a lot of major programs, projects, and issues to juggle at the moment on both sides. And of course, not to mention the exhaustion of the long days and the sometimes the surprising mental and emotional overload at times being here in person. But yeah, so it's not been easy coming to the other side of the world for something like this, but certainly worthwhile.
Oh, thanks, Melanie. And I'm conscious of knowing you've been working back online with your team in Australia through the night and then coming and bringing this amazing presence to our meeting. So thanks for being here. Karen, really great to have you here too. What are your thoughts on this topic? And can you tell us a bit about what it took to get here?
As I unmute myself. Absolutely. As I mentioned before, this is my volunteer role. So I work 4 days a week for the South Australian Chamber of Commerce. And so I took annual leave to come here. And of course, with this opportunity, I was able to add a little bit of holiday onto it. The last week, though, has been incredible. It has been exhausting. It's been emotional, as Melanie said. I have learned so much. My brain is exploding. But I wouldn't have had the confidence to put my hand up for this if I hadn't been to the Adelaide HTA. So having the HTAI conferences each year in a different country welcomes the people in that country to be involved. And I know there's a focus on passes, for example, for 50% of people, the passes are for people in that country to attend. And that was so beneficial for me. I had my first, as I said, my first experience of HTA about 8 years ago, maybe even a little bit longer, as a result of an amazing clinical trial and allowing access to a life-changing drug and a game-changer, melanoma, which was one of the first drugs, as Chris is currently experiencing, one of the first drugs available for people with stage 4 melanoma. So it was an incredibly emotional time. And I realize now, I look back and go, wow, how little did I know about what I was doing and how much more powerful I could be now that I've had this knowledge and experience. And the other thing I've done in the last year, of course, has been involved in the enhancing consumer engagement in health technology in Australia, the co-design group. I was fortunate to be chosen to be one of the consumers on that group. And that has been a magnificent process. The HTAI this year has just taken what I learned in that process and added to it. In some ways, I want to sort of go back and make some changes, but we will be able to use the information that I've gained in unrolling this and working further in this area of enhancing consumer engagement in HTA from the very beginning of the process all the way through to the end.
Thanks for that, Karen. That's a really thoughtful contribution. And I noticed that, and thank you, Karen Woolley, in the chat for your question. I'm going to come back to your question a little later, which looks terrific. But that's an interesting idea about HCAI is one of those meetings that actually moves from location to location each year. And my mind boggles at how the little secretariat managed to pull the event from location to location. But what it means, of course, is that you get those different opportunities to engage with the local people. And next year it will be Buenos Aires in South America, and giving us a chance to work more closely with that community. So it's a really interesting thing about how we see it and how we keep building and reinforcing this excellent relationship. The thing I wanted to mention, Karen, just too, is that your connection is okay. We can hear you. It's just getting a little bit funny at times, but I don't know whether anyone online is using any adjustment for which the occasional dropout is then causing problems for captioning or anything. If you can give me a private message in the chat or something to let me know if the sound on Karen's line is a barrier, we'll ask Karen to turn her camera off. But if it's not, I'm going to try and keep her her face on camera for a bit longer. So please let me know. Okay, so panelists, can you share with us some of the subjects you heard? It's been a dense 5 days. Some of the things that you found interesting or useful that you heard here. And maybe, Melanie, I can start with you on this one.
Yeah, there is so much. There's too much to really go into every topic or session that was meaningful or interesting, because there was something in all of them. So my general reflections, I think, was that I really found through listening to the speakers in the presentations that everyone here has the right motivation and a desire to make HTA accessible and user-friendly, especially for patients and patient organisations. But I think what I did learn is that each region has a slightly different approach and a slightly different stages of that. And so this conference has really been an opportunity to learn so much from each other and be encouraged. I think one of the biggest take-homes for me, and it was in a session that caught me very much off guard, probably because I was tired as well, but really hit me emotionally, but also the reality of things, is that patient involvement in HTA is essential, and meaningful involvement takes time, takes money, takes resources, but particularly the one resource that is finite and scarce within our very busy patient organisations is energy from the individuals involved. And yeah, it's no doubt that patients need to participate in HTA, but the question was raised, at what consequence and at what cost? So if we are spending our scarce resources on HTA, it does mean that we might not be putting in as much effort that we want to be putting in other areas of support. So we really need to be clear that when we do work on anything with HTA, that it is having the impact that we need it to have. I think that was probably one of the subjects that did make the most impact for me, but learning from some of the others on how the HTA bodies are finding ways to reach out, connect, and bring those patient organisations into the process that maybe have been not as engaged previously, was, yeah, probably one of the biggest learning parts of the process for me this week.
Thank you, Melanie. That was that's really helpful for those of you who have conference attendance. whether you're virtual or whether you were here in person. If you didn't catch the session that Melanie was talking about, I'm just going to tell you which one it was, where we were talking about burden. I was listening, you'll be pleased to know, not talking for once. And it was PN01, and the session was about balancing impact versus burden of patient involvement in HTA. And in it, Eric Lowe, who used to be Myeloma UK, and I know many of you online, spoke very candidly and clearly about what the burden was to get involved. And I really am pleased that we were able to have it recorded. I mentioned at the time that Jessica had shared from her patient perspective what it had been to involve once. And unfortunately, due to the Wi-Fi quality of the day, the recording hadn't stayed. And this takes such a huge amount for someone to actually go back to that when it's been an enormous burden and think about. And so I'm really pleased that we're able to have it as a recording. And I want all stakeholders to be able to learn from this and think, how do we do this better? How do we make sure that everything we do counts? And so thank you, Melanie, for reminding us of that session. And it makes me want to stop and say thank you to everyone who persists in this area in the patient communities, despite these things not having been fixed yet. So thank you. I'm going to go across to you now, Karen. What were the useful ideas, the things you're taking away, the things you'd like to share this morning?
Oh, it's really hard to try to identify, but I suppose across all of the sessions was this very firm belief that consumers or patients, as they talk about it in Europe, are a distinct third pillar. They are not. And sorry, my internet, I'm being told my internet is unstable. They are not an optional extra. They're not a nice to have. They are part of the system, and they are the third pillar in delivering a sustainable and innovative HTA. That's always a bad word for me, innovative. But I think, and it also then taking from there the need to involve patient views, information in early HTA. This is something we've talked about, but I have learned so much by attending this conference or the Congress and actually diving in more deeply about how that might be done, how practically we can do that. And that goes from everything from how we measure patient need all the way through to when we collect information, where does it get stored? How does it get stored? The cost of storing it. So those were some of the things that I found particularly interesting.
Oh yeah, really, really interesting points there, Karen. Some of those issues we never quite get to talking enough to actually progress into action and to resolve. Thank you for that. A little warning now about my access to the internet. If I disappear for a minute, don't worry, you can go on without me and I'll have to go back to the recording and hear what you said. Telstra is sending me some warnings. Jessica, I promise not to break the bank on running this off my personal hotspot. I think any of you who've ever done meetings from the hotels will understand some of our technical challenges this morning. Chris, can I come across to you and Jessica now?
Okay.
What are you taking away?
Yeah, thanks. Yeah, I think I just build on what both Melanie and Karen said, but I think, you know, we learn about the challenges of doing that authentic, transparent involvement of patients or consumers, as we call them, in the process. And also when we do that, some of the challenges Melanie touched on were the resources. And in one session I went to, it was a survey that was sent out to HTA representatives who sit on the committees and asking them about how much patient preferences should be included in the HTA process. And it was like 100% yes, and they recognised the barriers. But when it came to the question of, well, who should resource that, either in human resources or funding, 80% said it should be the patients or the patient organisations. So there was a recognition of how important it was, but then, you know, the burden of that was swiftly turned back on patient organisations. But one of the kind of key themes I tuned into across the conference was what is out there that enables or makes that process easier, smoother, more accessible for people like myself and others who are looking to prepare their communities for the HTA process. Sorry, that's my son calling from Australia. Really looking at what other countries and HTA bodies are doing to include patients. So I think Melanie touched on that. We were in one session where people presented how they're doing that authentic engagement, and some agencies are actually reaching out, like they're actually actively going out to patient groups to make sure that their voices are embedded in submissions and considered in the process. And they're doing that off their own bat as part of their commitment to involving patients. And there was one other program that I saw yesterday. It was called Living Experience, and it's an online program. It's part of a research team in Madrid, where you as an organisation can sign up and you can basically run through the process. It's got questions. This is what you need to consider for each piece. So it's an online iterative program. So you can keep adding your evidence and data as you go. You can so if you have more than one therapy that's going through the process, you can set up different projects within the platform. And I just felt that was a really great supportive mechanism for patient groups to do it in an ongoing way. A number of people can have access to that, and make sure you're ticking all the boxes that this research team has seen as a framework in preparing for your submissions. I can share that link out if people want to have a look.
Yeah, thank you. If it's possible, we could get it in the link. Otherwise, we can share it around. We might share it also on our social media. And Chris, just to say, if you need to take a call and pop out for a minute, it's absolutely fine. Thanks for all you've given us, and you can pop back in when you're able. That's fine too. Jessica, what about you? Are there additional things that you've heard that you're thinking about?
Yeah, look, I really want to pick up on that piece that we were just speaking about a moment ago, about some of the conversations around opportunity cost and burden. And what I'd say is that in reflecting sort of from when I first got involved in my first HTAI conference to now, what has been the enabler for that conversation is having more patients in the room. And for me, it's really jumped out that bringing more patients and people who work with a patient-centric lens into the room is not only important for capacity building individuals and organizations, but for building a critical mass that creates a space where we have enough representation in the room that people can feel like they can share a much more authentic reflection on what it's like, because they know that there will be other people in that room that say, yeah, me too, or that there will be other people who back them up if they say to another stakeholder, hey, that's how that works for the patient community. What we do is by having more patients is really allow a greater depth to the conversation around patient involvement. And by doing that, we're not just benefiting the patient community, we're giving all stakeholder groups a better understanding of what it is to involve patients, what we need, and how we meet those needs. And so that has been a real highlight for me and a bit of an aha moment that the importance of bringing people, not just for the individual or organizational learning opportunity, but for making sure we are achieving a much more holistic view of what it's like to be a patient and to create the community that comes with that. We've all of us, I think, who are patient representatives of advocates have stood in a room and sat in a room where we've felt a little bit of an imposter syndrome, or we know that we've been invited to the room, but we don't really feel like we're being given a microphone. Bringing more patients to HTAI means that we feel safe to get up on that microphone and share our true experiences of patient involvement.
Oh, thank you, Jessica. And what you just touched on there, to me, just reflects straight across to the really important point Shona just made in the chat. For those of you who can't see it, Shona was reflecting on what Chris was discussing about how this survey suggested that a lot of people thought, you know, patient organizations should be doing all this research. And one of the things I'm conscious of, if there's no one in the room that can challenge that concept. So in these meetings, there's been patient organizations that go, whoa, well, just a second there. Maybe there's some things that you need to understand about the way patient communities work or how patient organizations work. But if you're not in the room where it happens, sorry, I just love the musical and I quote it all the time. But if you're not in the room where it happens, that moment where someone's assumptions come to the fore is missed, and you don't get the chance to help them have a better understanding. I was saying earlier, last night I was writing questions, you know, late at night. We're really well prepared for this. And I fell back on some old ableist assumptions in my questions. And then this morning, you know, rush to do this. But Jessica just kindly just refocused me, like, hang on, you know, and it's good, because if you don't get that fed back, and if we're as a patient community is not there when people are coming in with their own lived experience lens, we can't do it, and we can't make this work better. Now, I had more questions. Did anyone have a favorite session? And if so, why? I don't mind actually hearing if there was a session that got you a bit riled up as well.
Can I just quickly jump in there, because the workshop that was on Saturday morning, it was held on Saturday morning, I actually asked the question about who was going to fund the data collection on patient preferences and how it was going to be done. And it was really interesting, because the people very much involved in that said, oh, well, I suppose you could go and get a grant and then invite us to do it for you. So it's obviously wasn't something that had actually been seriously contemplated. So it is something that we need to have a look at and definitely work out how this could actually happen.
Thanks, Karen. Thanks for jumping in. That's really useful. Do jump in, panelists, if you want to add anything to any point at any time. Is there anyone who wanted to raise any particular session that they thought was really valuable to talk about this morning, either because it had great things you're going to take away, or important things that you have to take away because it maybe flagged some issues?
I will give a bit of a shout out to the workshops as well. And there are many sessions throughout the conference program that were brilliant, but I really enjoy the deep dive of the workshops. I had a tough decision between the rare disease workshop and one that was less familiar to me, and that was the non-traditional roles of patients in HTA. And I'm actually very pleased with my decision. I think it was a really really valuable session, but slightly differently run in that there was a practical element of stepping through in a very, very, very brief format, an HTA process and taking on the perspective of the different stakeholders in that. And I think that was a really excellent concept that I would like to try and replicate in a form, perhaps in a workshop back in Australia, because I thought that was really interesting, and also gave some great insights, historical background to ways things like compassionate access programs have been used in highlighting the need for a medicine to come to market, and some of the history behind that. It was a really fabulous session.
Yeah,
Thanks,
I just
Jessica.
jump in there. The
Melanie, I
last
can see you there, yeah.
the last session yesterday talked a lot about what are the obstacles for HTA, and there are many, but again, for rare diseases, more on top of that. But they did talk about that, you know, RCTs, randomized controlled trials, are just not going to be possible all the time, and what are some of the substitutions for that. And so they talked a lot about observational studies and what that might look like. And so compassionate access might be one way, and there of course are others. So that I think that's really interesting that that's being thought about. I think one of the reflections for me is potentially the disconnect between the work being done at HTA and then that connection back to manufacturers and some of the pharma and biotech groups. And I think there's opportunities there to connect that those two. And so the research that backs the processes and the frameworks and best practice, and bringing that across either through the patient groups or, you know, through more meetings like the HTAI. So that was another sort of observation from my perspective.
Thanks, Chris. Melanie, you had a thought there too.
Yeah, I've been trying to pinpoint exactly which sessions had which golden points that we've been talking about, and it's hard to kind of go back because we've been through so many sessions. But I think one of the controversial ones, that there were some really good points made in, but also some challenges, was a lunch symposium about embracing perspectives in health technology assessment and integrating quality of life and patient experience into the preferences. And there was some good debate in that one as well. So I found there's some challenging points raised in many of the sessions. But one of the things that I think a take home from the sessions I got was that HTA is not necessarily this big, scary, distant bureaucratic system that operates in isolation. At least it shouldn't be. And they do want us involved. We've just got to work out the best way to do it for ourselves and for the HTA systems. And I think the ones where I really had that desire for that personal touch and outreach from places like Scotland, Ireland, and even the US, that was a bit of an eye-opener to me, what's happening in the US, considering they don't have a federal HTA body, was really interesting. But I just also want to say, in relation to Australia, I was so impressed at the variety and the number of Australians that did make the effort to get to this conference. We were certainly overrepresented, and it gave me a lot of encouragement too, that the motivation is there to keep improving the system that we've got. And it's a system that is very much still in development and will continue to be in development. This idea of innovation and moving forward was the theme through all of the sessions. But yeah, I'm looking forward to going back actually to the recordings and to the notes, just to pull out those golden nuggets a little bit more and work out which ones I need to do a bit more of a deep dive into.
Thanks, Melanie. That really actually leads nicely into Karen Woolley's question in the thread. Karen asked earlier, and I think she's had to leave us, but the recording of this will be available, by the way, everyone, and we'll put it up on YouTube. But and I can see we're got 15 minutes just to give everyone a little check-in on where we are on our clock. But Karen made the point that we can learn valuable insights at international conference. But were there particular areas at HTAI 2024 where Australian HTA efforts were being recognised as world leading? And if so, what areas were there? I'm going to throw one in straight away. I had the pleasure of being with Tracy Merlin and Richard Diablo Lourenco, sorry, got tongue-tied the first thing this morning. And we were on HTA Review, and people's minds, I'm going to say, looked like they were being blown at what those expert papers from HTA Review cover and what was done in that time. And I think that's an amazing contribution to this area. Other thoughts from the panelists?
One of the things that I found from Australia's point of view, and that came up fairly early, just before the conference started, the European Patients Association released a 10-point recommendations for the European regulation changes of what they wanted to see out of the this regulative change, and this is coming into effect in January next year. It is going to be big. It's a harmonisation, so it's not going to force every country to change. But the 10 points looked so much like the points that came out, and I'll have to just refer to the draft because everyone's seen the draft of the enhancing consumer engagement in HTA recommendations to the Minister, which will be given to the Minister on the 30th. So watch that space. What was lovely, though, is that we are all thinking the same way. We are, no matter what country we are in, that we are reflecting each other's thoughts, which I think means that we are getting to that tipping point of we know what we want, and we're not bound by our individual countries' systems. We are pushing through that. The other thing I wanted to say is it was also the chats. It was the chats when you accidentally, or you popped a cup of tea down on a table and introduced yourself to somebody, and then just disappeared into this conversation about things that you would never otherwise have heard about, and everyone was willing to chat, and I learned so much from those chats as well.
It's true, Karen. I think we're all losing our voices over those chats. Just to draw attention to something I wanted to mention today. The other day when I was in Canberra, I was having a great chat with the wonderful Jacqueline Tate from Myeloma Australia. And Jack's just drawn our attention to, we've got this really vibrant community that we started to really see in Adelaide, because we could see who was doing this and interested in Adelaide. And we started talking about how can we have something back in Australia for this community. And I've been talking with people here. And so that's that to me is a big action point that Jessica, as well as I've talked with HTAI and various other Australians who are here from different backgrounds. Now, because so we definitely want to follow up on that, and we'd really appreciate all your ideas around that. I know we're coming to our final minutes, and that time just went like that. So I'm just going to ask our panelists if I can go around and hear from each of them either anything they want to add that they really want people to hear that they heard, or take away, or a particular action. Can I just go around you one by one to try and bring forward some more of those ideas we heard, and then I'm just going to check in again on the question. So if you're in the audience, please now is the time to get your questions in the chat box, and or even if you want to share experiences there. Jessica, maybe I'll go to you first.
Thank you. And I would just like to pick up on that piece too. I absolutely agree. And it's something that Chris and I have been discussing, what it would look like to be having those conversations at a local. And I think we could bring our Kiwi friends in on that as well, because I think that's important. But having a space for that, and a space where I think what's really lovely to see is that we are all really resource strapped organizations and advocates, and something that looks like being able to share small pieces of information that's not adding to our burden, but is a place where we can share snippets of ideas and light bulb moments, and then those who have the time capacity can then build on that. I'll go rogue and say we started a little WhatsApp group to sort of start chatting about what that might look like. So if anybody's keen to continue that conversation, we can perhaps drop Cecily an email and we can think about how we make that a starting point perhaps. But other things that I look, my notes list on my phone has a list a mile long, so I'm going to have to take a moment to prioritize that list. But some of the things that I think are easier actions that I'd like to take away, as people might know, I know we have the beautiful Claire Stewart Online Patient Voice Initiative have a second season of our podcast, and I've already come up with a run sheet for the third season that we can highlight some of those international experiences, because I think in coming together as a global patient community, what's been an important reminder for me is that in Australia we certainly have work to do, but as patient organizations, I think information sharing, particularly in places where they don't have the networks and resources and HTA knowledge in patient communities, is a responsibility. It's important. So how we can support that dialogue. I have many resource ideas. One thing that I again had this realization, and it's one of those things where you know something to be true and it's sort of so normal that you don't think about how we could do it better. But I've had that conversation with many advocates in the room around that feeling of not having the confidence to speak up, or not having feeling like you have the role, and that, so how can we make sure in our resources at PVI that we're offering a place where people can maybe a module or some tips around overcoming that. I putting my health coaching many lifetimes ago hat on, how can we just foster that simple confidence in particularly individual aid advocates or smaller groups to do that, and support them to do that, and support them to speak up with confidence. So that is my word vomit to conclude what has been an absolutely brilliant time and event here in Spain. I think it says definitely Jessica needs a long siesta today.
It is the season of siesta. We have 5 minutes to go. So to Chris, to you, what can you share with us in this last minute I'm generously giving to your expertise?
Yeah, so like everyone who's been here, like the mind is kind of going 100 miles an hour, and I am one of those people that needs to pull myself back a lot from my ambitious plans. But yeah, so Jess and I have been talking a lot about like how we, connect conversations in Australia in an ongoing way. So keen to help facilitate that. And then for myself, I'll be doing some work with rare disease groups as well around HTA and sort of that preparatory process. But my big one is I'm thinking of not myself, but potentially funding like a PhD or a project around some of the work that our community needs to do. So around that patient preference. So I'm doing a bit of scoping as my PVI patient partner project, but then like what are the next steps, and sort of looking quite constructively at that and what that might look like. So I'm pretty excited about that.
Fabulous, fabulous to have you here. Melanie.
Yeah, I think reflecting and repeating really what Jess has said, I'm really so grateful to PVI for this opportunity, and it's really assisted me to work out what I want to do to give back. And I really want to work out how to assist our patient community in Australia feel as much a part of HTA as they want to be. This has built up my confidence and understanding of where I can participate, and I just want to be able to pass that confidence and understanding onto other small or new patient groups and have some form of outreach program, because this is really a beautiful culture here where no matter what your background, experience or speciality, you do belong in this community, and we want to make sure that people know that.
Well, thanks, Melanie. Fantastic point. Karen.
As you might have picked up from the comments that I've made, I have real interest in that early HTA involvement. I've been speaking with people throughout the conference and gathering more information and history to this as well. And so working with PVI, part of the partnership, that I would like to create some resources about the how-to and what's available out there. HTAI have a working group that's coming up with a glossary, which I think we can help share out. So there are a whole range of things that I'm looking at the moment, because I think this is where our power is, our raw knowledge about what we need and what our communities it has to be brought in at a much earlier stage. So let's work on that.
Thanks, Karen, and thanks everyone what a huge thing to cover in such a short time. I'm thinking about the keynote address about how HTA actually makes high value. There's so many topics we've covered in this space. So what I want to do is draw attention. You've seen some of the people today who were involved at the meeting. Also from our Patient Voice Advisory Committee, you can see some of them online today. They were here as well. So Richard Diablo Lorenzo was here. You can see Monica Ferry there has been taking part online. Also Simon Pfeiffer, the Capri team here in Seville itself. Jen Handley here has been taking part virtually. She will have a wealth of information, and I was hoping to bring her in. So talk to Jen. Sorry to throw you in there, Jen. David Lockwood has been taking part virtually. So go talk to David. Someone else from Australia, Trent Zimmerman, who's now with Alexion, has been everywhere here, and so wonderful to see him here. So these are all people who have been here at this event. So when you bump into them, I'd love us to keep these conversations going. I'm just going to quickly make a thank you to our sponsors. Here's our silver sponsors. We could not do any of this work without our sponsors, and we're incredibly grateful to them. And here's our gold sponsors. Our gold sponsors list has expanded. The opportunity that gives us, because we would like to bring more people to these events and find more ways to take part in these conversations if you can't be at these events, and somehow get through the to-do list that we're walking away with, and goodness knows but how long it is when they all combine. I'd like to say also a huge thank you to our panelists, all Chris, Jessica, Karen, Melanie. You got a little insight into what they were doing to be here. But those of you in Adelaide know how full on it is, even when you try and be sensible at this event. So thank you so much for that. May I make one more reminder? Jessica hosts this amazing podcast, the Patient Voice podcast. It dropped for the first time last week with Claire Stewart, and such a terrific first episode for our second season. And so please just use your normal provider and check that out. Check out the Patient Voice Hub. 2 new topics about to go up. One is about preparing when something's in the pipeline, so not when it gets to HTA and it feels way too late, but preparing when it's in the pipeline. And with that, I'd like to thank everyone for your huge contribution. For those of you who gave your time to joining this session, we really appreciate it. And we look forward to talking more with you and learning more with you in our following sessions.
And
Thanks
before,
goodbye
I think
for
we
now.
need to also,
Oh, sorry.
sorry to jump in there, thank Anne, because Anne has done a tremendous amount of work, not just for this conference, but I think as former chair of the Patient Citizen Involvement Group and now vice president of HTAI, I think she has worked tirelessly to create a culture at HTAI where we do have had this forum and have had this presence and the shift in conversation towards a more patient-centric system and through a more patient-centric lens. And you are absolutely incredible and so dedicated to this work. And we thank you for all your efforts and your lack of sleep. Now go and have a siesta. Thank you so much,
I
everybody.
will.
And thank you to our Patient Voice partners.
Thank you,
and of course,
everyone.
our sponsors, and Cecily and little Teddy
Cecily,
there.
and thank you, Teddy, as well. And thank you all. And thank you for what you do for your patient communities and for everyone else for that day when they learn what it is to live as a patient. Thank you all very much and enjoy the rest of your afternoon or day if you're here in Seville.
Thank you, everyone.